Hi, everyone. It's Dr. Jasmine, your natural holistic health and wellness guide on this journey we call life. Thanks so much for joining me today. We are in the two-part series of hormones and hair growth. This is part two, really focusing on the female hormonal cycle in menstruating age women. So let's jump in.
The
All right,
menstrual cycle.
or the female hormonal cycle, kind of the basics of it is what we want to remember is that when we're born as female, we are born with all the eggs we're basically ever going to have. And monthly, we release approximately one egg for fertilization. And this happens at menarche or that age of puberty. That's when your first cycle happens. If that egg is not fertilized, and the lining that has built up will shed after about 28 days. If fertilized, then you become pregnant, right? The menstrual cycle is broken down into two parts. So that first part is your follicular phase that stays 1 through 14. That's where your follicle stimulating hormone or FSH is triggered and tells your ovaries to mature your follicle for ovulation. The follicle then begins to increase estrogen production. At day 14, luteinizing hormone or LH is released in what's called the LH surge, and this tells the follicle to erupt from the ovary or ovulation. Days 15 through 28, this is called your luteal phase. This is when your body is increasing progesterone, your uterine lining is just building up nutrients and blood to prepare for pregnancy. Now, if you don't get pregnant, which most months we're not, fertilizing an egg, this will cause you to bleed at that about 28th day. On average, cycle days range from 21 to 35 days. You can be normal within this range, 28 being that sweet spot. Okay, so that's kind of a normal cycle. That's what we expect to happen. Look here, this is like a visual depiction of what's happening. Like that yellow LH has surged right before ovulation, and then after ovulation, you see that blue progesterone rising and then falling down as we prepare to shed that lining. So, what does this have to do with hair growth? Well, a lot. As women, if we are not rising and falling at the correct rates, or we're producing more of other hormones, our follicles will respond. And this is closely related to a condition called PCOS. Now, this is an actual diagnosis. If you have some of the things that I talk about today, it doesn't necessarily mean that you have PCOS. If you're curious, you might talk with your doctor about getting a specific testing and diagnostics. But a lot of times I find women aren't necessarily diagnosed with PCOS, but are experiencing some of the fluctuations in their hormones that might be causing them to experience some of the hair shed associated with this particular condition. So, what's kind of happening here? The ovaries are typically what's called polycystic, meaning they're not really rupturing those follicles every month as expected. So sometimes they'll go, you know, months without actually having a cycle. Typically, if you're having less than 8 cycles a year, it's considered an issue. And then because those follicles aren't actually erupting, that's how that cyst forms. We also see, in conjunction with this particular condition, high production of androgens. So that testosterone, that DHT, those are usually increased in this condition and shrinking the follicle, leading to shedding. We'll also see, like on blood work, higher levels of FSH and LH, and this is because your ovaries just like aren't responding. So the body's like, well, I gotta release more to get those ovaries to start doing what we want them or need them to do. Because of these high androgens, what we sometimes see, I'll see this quite often in women, is that our excretion or detoxification of our hormones is a little sluggish because there's just more being produced. There's more stress on the liver to actually excrete that. So detox typically gets backed up, again leading to, more of that shed. Some symptoms that you might experience, or if these sound like definitely, keep an ear out. You probably are going to have more irregular cycles or no period, a longer or shorter cycle, so less than 21 days or longer than 35 days. And sometimes I'll actually see women who are like in that 32, 30 range. That's a little concerning. Again, not like not having a cycle, not necessarily PCOS, but maybe not optimal. A lot of times I say there's a long journey between disease and optimization. And if you're right here, you might not be in a disease state, but you might be experiencing some of the symptoms associated with that disease. Now, if you were to get diagnosed, you would need to have three of these criteria mainly associated with those polycystic ovaries. So that's usually about 12 ish cyst on the ovary seen on ultrasound. You'll usually experience some of that hirsutism or the symptoms of high androgens. So that's usually facial hair around the chin, the upper lip, sometimes on the like thicker hairs on the sideburns, and then that alopecia. Menstrual irregularity, insulin insensitivity, so being more resistant to insulin and sugar uptake is a hallmark of this condition. Obesity, even though this isn't something that is required to have the condition, it's often associated. But please don't think because you're not obese that you can't be suffering from this. Infertility is also a consequence of this condition, and then hormonal acne as well. So we talked about the liver, right? We talked about how all those androgens are just increasing demand. So how do we help our liver, right? How do we help these hormones go through those phases of detoxification efficiently so they're having less effect on us? Well, the really great thing is there's lots of herbs that we can use in our cooking, in our teas, just to help overall support of proper liver function and health. So one of my favorites is milk thistle. Milk thistle is a hepatoprotectant or liver protectant, and it increases the production of an antioxidant called glutathione. And if you know me, you know I love glutathione. I'll probably talk to you more and more about this particular antioxidant, but it is definitely required for majority of toxins that we produce, that we get exposed to be actually detoxified. Then we have dandelion greens. These make really great like bitter greens in your salad or an iced tea. And this reduces the risk of liver damage and disease. So it's not necessarily directly upregulating production of antioxidants like milk thistle in the same way, but it's reducing the damage from other things that we get exposed to, right? It's also increasing bile flow. So there's a part of detox that does require bile. So this is super important. And then last but not least, and this is not an exhaustive list, guys, but burdock is a really great herb as well because this is gonna protect it as well, kind of like that dandelion's going to protect your liver cells from injury of toxicity. And then foods that we want to kind of focus on are broccoli, Brussels sprouts, artichoke, cabbage. These foods are rich in sulfur, and sulfur is another required nutrient that helps with basically tagging your hormone for excretion. So it basically says, hey, this one needs to be needs to be gotten rid of. So because I've tagged it, your body now knows, okay, push that guy out. And without enough sulfur, they just kind of hang out, right? Causing more damage, causing more symptoms in that person. So if we're eating these foods regularly, we can help reduce our risk. And so we talked about this in part one, but those five alpha reductase stimulators and blockers, we want to reduce, how much we're eating processed food. We want to um, stimulate our liver, right? We want to reduce our use and intake of phthalates and hormone disruptors. And then we can start incorporating different blockers like saw palmetto, sticky nettles, bacopa, pumpkin seed. These are all really good. African cherry tree bark. These are great herbs that help reduce that conversion of testosterone to DHT, reducing its effect on our bodies. So just to kind of pull it all together, our reproductive hormonal system is so integral into how we're growing hair, our ability to keep healthy hair. If you are have any type of fluctuations with that, whether they be very significant and you maybe are have been diagnosed with something like PCOS, or maybe they're a little milder, but you're seeing some of the hirsutism, you might be experiencing higher levels of androgens that might be putting you at risk. And then focusing on our liver, remembering it plays a role, well, not even a role, like one of the biggest roles in excretion and tagging of toxins and excess hormones to excrete them out. So by supporting all of these, that's one root cause that we can really help reduce its effect on our follicles and our ability to grow healthy hair. So, guys, thanks so much for joining me today. That's all I have for you today. If you have any questions, definitely leave them in the comments. I'd be more than happy to answer them. Uh, Thanks again for joining me. If you're, looking for consulting on your hair journey, definitely visit me at www.drjasmine.com, and that's Jasmine with a Y. All right, that's my time, guys. May God bless you and your health. Bye.